Good morning. Welcome to this fourth webinar sponsored by the Maricopa County Department of Public Health on the Affordable Care Act. My name is Lori Stillman and I'm from Health Resources in Action, a national nonprofit public health organization located in Boston. We've been engaged by the Health Department to help them better understand their role in preparing for the full implementation of the Patient Protection and Affordable Care Act, as well as the role that their partners can play in ensuring its efficient and effective implementation in the state of Arizona. To that end, we've produced some in-depth technical reports, subject matter fact sheets, and webinar presentations that are tailored specifically for the healthcare, community, education, and workplace sectors. To date, we presented webinars geared to the healthcare, community, and education sectors, and now we're presenting the last webinar about how the ACA can impact the employer and business community from a public health perspective. These presentations are focused specifically on opportunities as they relate to the Affordable Care Act, not all of the ways that you can work together to promote healthier people and healthier communities in Arizona. The presentation will be about 30 to 40 minutes long, and then we'll have some time to field your questions. Two caveats, however: the information and recommendations contained in these presentations are an expansive set of opportunities for working together with your health department under the ACA. The information is meant to stimulate conversations and a planning process where together you can prioritize what priorities are the most important and realistic to undertake. Secondly, the report and fact sheets, as well as recordings for these webinars, will eventually be posted on a public webpage that the Health Department is in the process of creating. They will be providing you with updates on its progress as well as other relevant information as they become available. So please tell your colleagues about how they can connect with the Maricopa County Public Health Department to learn more about these topics. Now let's get this webinar started. Brittany Chen will be the presenter on behalf of Health Resources in Action, and she's now going to focus on the employer or worksite sector. Due to the large number of participants, nearly everyone will be on mute. However, so that you won't be able to communicate verbally with us. However, we do encourage you to write your questions in the question and answer dashboard on your webinar screen at any time during this presentation. And we'll try and answer as many of them as possible at the end of the presentation. Please don't use the raise your hand function on the dashboard, however, because this will only tell us that you have a question and not what that question is. Those questions that don't get answered will be forwarded to the Maricopa County Health Department, and they will communicate to you the answers at a later date. Finally, after the webinar concludes, you'll see a very short survey which we hope you'll complete online. Thank you for your participation, and we want to let you know that if you participated in any of the prior webinars, the first few slides will be a repeat of that information, but a lot of new information will be presented thereafter, so stay around. Okay, here's Brittany.
Thanks so much, Lori. It's great to be here with you all, albeit virtually. So today I'm going to be talking about the impact of the Affordable Care Act, relevant ACA worksite provisions for employers. We're going to talk about why businesses should care about health, as well as strategies for employers and health departments to jointly promote employee health. So let's start out with the impact of the Affordable Care Act. One of the most important aspects of the ACA is the increased number of people that will be enrolled in health insurance. As of January 2014, 1.3 million people in Arizona are expected to gain coverage, either through enrolling in Medicaid or in private insurance through the state's exchange. This number could even be higher, as Medicaid was officially expanded in Arizona last week. It's not completely known yet, though, how this addition of insured people will affect the healthcare system. There have been studies of the current uninsured population, and they suggest that they may be in poorer health than the currently insured, and that they may have a pent-up need for services. Many of the people who become insured in 2014 will be new users of health insurance. They may need assistance in enrolling for coverage, understanding the benefits that are available to them, and the appropriate site for accessing different types of services. For example, they may be used to getting care in free clinics or the emergency room. instead of with primary care providers. And this will require education to help change these behaviors. Also, there will be a continued need for safety net services. Approximately 650,000 people will remain uninsured. This will include people waiting to qualify for benefits and people whose Medicaid status will change due to meeting eligibility requirements, and this is often known as churning. Safety net providers will continue to be an important source of care for this population, as well as newly insured patients who would like to continue at community health centers where they have been treated in the past. With this increase in insurance coverage, there will be likely a resulting and hoped for demand for primary care and prevention services. And this increased insurance coverage and demand for services, coupled with the remaining uninsured population, provides opportunities for the public health field in the ACA. So when people often think about the ACA, they often think about health insurance. However, it's much more than that. While it is an important aspect of the ACA, the major focus is commonly referred to as the triple aim, which includes improving the quality of care, improving population health outcomes, and containing healthcare costs. Population health means improving the health of the whole population, not just focusing on individuals. This requires reducing health inequities among population groups and addressing the factors that impact health, referred to often as the social determinants of health. These include the physical environment that people live in, employment opportunities, and education. Population health focuses on primary prevention, which means focusing on preventing the occurrence of disease and injuries, and also helping people manage chronic illnesses that they have more effectively. So the focus of the ACA is broad, and to meet these goals, the work of multiple sectors are all needed to focus on the real drivers of health. This focus is a major change for the healthcare system, which will have increased responsibility for good patient health outcomes, rather than just providing services. However, healthcare providers are not expert in population health, prevention, and disease management. Healthcare providers are generally unfamiliar with how to connect with community resources and how to improve communities themselves as a strategy to improve patient health. So this is where public health is primed to come in. For this webinar, I will focus primarily on strategies to improve population health within the workforce sector. However, focusing upon improving population health will also likely lead to a better experience of care and lower per capita costs as well. So thus, moving towards the triple aim. So there are a number of relevant worksite provisions for employers through the Affordable Care Act, and I'm going to walk you through them right now. The first relevant provision that pertains to workplaces focuses on employer-sponsored health insurance. The ACA creates incentives to employers to provide insurance for their employees and to encourage employees to enroll in employer-sponsored health insurance plans. And I'm going to refer to that as ESI because that's a mouthful. Specifically, the ACA requires that employers of over 50 employees cover insurance, or they will have to pay a free rider surcharge for employees that use subsidized marketplace coverage. This penalty is determined based on whether an employer offers insurance coverage that is affordable and adequate and the number of full-time employees a company has. The ACA also provides tax credits and creates health insurance exchanges to encourage small firms to offer coverage through the Small Business Health Options Program, or the SHOP Exchange. The SHOP Exchange reforms the health insurance market by making it less expensive for small firms to provide coverage for their employees. As of January 2014, no premium rating can be based on health status, claims history, industry group size, duration of coverage, and other factors. Furthermore, employers will be eligible for tax credits to assist them in purchasing health insurance if they have fewer than 25 full-time employees, their average annual salaries are less than $50,000, and they contribute to at least half of the cost of employees' health insurance. And finally, the ACA also provides options for individuals who do not have employer-sponsored coverage through the health insurance marketplace. So the majority of ESI plans comply with the ACA's preventive care mandates, which include free benefits such as immunizations and screenings, and the Essential Health Benefits Package, which are a set of core, federally required benefits. However, plans that are grandfathered do not need to do so. Grandfathered plans are plans that were in effect on or before March 23rd, 2010, and have covered at least one person continuously from that day forward. Grandfathered plans still need to follow some of the ACA's mandates, and specifically they need to extend dependent coverage to adult children until they're 26 years of age, and are prohibited from applying lifetime dollar limits to essential health benefits and canceling insurance coverage when people get sick or due to an unintentional mistake on an insurance application. A plan will lose grandfathered status by eliminating benefits, increasing member co-insurance by any percentage amount, increasing the fixed dollar cost sharing beyond allowed amounts, and decreasing a plan sponsor's contribution toward the cost of coverage by more than 5%. By January 2014, it's actually estimated that at least half, if not the majority of ESI plans will lose their grandfathered status. This is mostly due to health plan design changes and/or changes to company subsidy levels. However, it is estimated that in Maricopa County, still between 6,000 to 24,000 employers will still continue to offer grandfathered plans, which could affect anywhere between 128,000 to 600,000 employees. This essentially means that most of these employees will not benefit from the expanded benefits required by the ACA and will have suboptimal coverage as a result. So in a moment, I will talk about why businesses should care about that. So finally, the ACA also includes provisions for workplace wellness programs. It should be noted that Maricopa County has actually shifted its efforts beyond workplace wellness to talk about healthy work sites. This expands the focus from individual behavior change to also acknowledge the importance of focusing on changing the environment of work sites to make the healthy choice the easy choice. However, the ACA does use the language of workplace wellness, and the final workplace wellness rule was just released this last month. Back in May, so last month. The major provisions of the final rule include continued support for participatory wellness programs that are available to all employees regardless of their health status. And these programs do not provide a reward or include any conditions for obtaining a reward. And examples of these kinds of programs include reimbursing for the cost of gym memberships or rewarding employees for attending a no-cost health education seminar. The final rules also provide consumer protection standards to ensure that health contingent wellness programs that reward employees who meet a specific health outcome or behavior are not discriminatory. These programs can include programs that reward those who do not use tobacco, achieve a certain weight, etc. In order to be considered non-discriminatory, there are technical rules that programs must follow. Some of the highlights for these rules include giving individuals eligible for the program the opportunity to qualify for the reward at least once per year, and providing a reasonable alternative standard for obtaining the reward if an individual finds it unreasonably difficult to meet the existing standard. And also, they must limit the size of the reward to no more than 30% of the total cost of the employee's health premiums, or 50% for participation in tobacco cessation programs. This is an increase from the previous 20% maximum reward that was permitted through the Federal HIPAA Act of 2006 that received bipartisan support. These rewards can come in the form of a premium discount or rebate, a waiver of all or part of cost sharing, an additional benefit, or some other financial or non-financial incentive. As Johnson & Johnson's CEO, William Weldon, stated, we dedicate resources to prevention because it yields steady returns. Those returns take on two forms: a healthier, more productive, more committed workforce, and significantly lower overall health care costs. This is an employer who has seen the benefits of investing in workplace wellness, which transitions us to the next section on the business case for promoting healthy work sites. So now we'll talk about why businesses should care about health. So Kathleen Sebelius, who's the Secretary for the U.S. Department of Health and Human Services, said, spiraling healthcare costs and declines in worker productivity due to poor health are eroding the bottom line of American businesses. In Maricopa County, as around the country, the majority of the working age population is employed and spends a significant amount of time in the workplace. In recent years, employer and employee contributions to health insurance have increased significantly. Nationally, health care is the most expensive benefit provided by employers, making up 8.5% of the total employer cost for each worker. Furthermore, 75% of all health care costs are spent on the treatment of chronic diseases, many of which are preventable. Thus, reducing health insurance and medical costs are of primary concern to employers, and public health prevention efforts can play a significant role in accomplishing these aims. Also, investing in the health of employees has other benefits, including increased productivity of the workforce, reduced absenteeism, which could be due to illness, family issues, personal needs, and so on, as well as reduced presenteeism, which is basically when employees who attend work, they attend work despite personal or family illness or chronic conditions and aren't productive, and they could also risk contagion to others. It should be noted that presenteeism has been shown to cost employers as much, if not more, than absenteeism. Beyond reducing direct and indirect costs, investing in workplace wellness initiatives can strengthen an employer's reputation by improving its image, provide employers with leverage for negotiating with insurance and workers' compensation carriers, boost employee morale, and promote employee retention, and enable workers to remain engaged in the workforce until reaching older ages. All of these reasons are important for public health to communicate to employers in order to encourage them to invest in the health of their employees. While workplace wellness programs require an investment of resources, the overall return on investment is, for every $1 invested, there was found to be a return of $1.40 to $4.70 per each dollar, realized over a 3-year period. Furthermore, employers have a huge impact upon population health as they provide the most common form of insurance among Arizonans. In Maricopa County, about 54% of residents are covered by employer-sponsored insurance. From this graph, you will see that though ESI coverage is predicted to drop slightly after the full ACA implementation, it is still the most common form of insurance. It should be noticed also that this drop has more to do with job loss due to a lagging economy rather than employers dropping ESI. Also, this estimation assumes that the population remains static between 2011 and 2014. However, because the population is likely to be larger in 2014, the absolute number of people with ESI will likely increase. As a primary provider of insurance to Arizonans, employers have a key role to play in improving health, promoting wellness, and helping to make broader changes to reduce preventable medical costs and increase the productivity of their workforce.
Cuffed in front. Now he looks up. He looked up at the helicopters. You see that? And now I believe he is shackled or at least restrained in his legs. Yes, he is. He is restrained. His legs were shackled and he's restrained, and he makes that quick walk, that short 10, 12.
I do apologize. It seems as though there might be some technical difficulties with the conference call line, and we will pause as we figure out what the issue is. Oh. It looks like it just stopped, so we will continue on, and I apologize for the delay. So, given these opportunities through the ACA, I will now talk about opportunities for Maricopa County's Department of Public Health and its partners to work with employers to promote employee health. From this point forward, I also want to mention that I will refer to MCDPH and its partners as just MCDPH. All right, so there are a variety of ways that employers can maximize the health of their workforce utilizing the new provisions of the ACA and partner with MCDPH to accomplish these goals. Starting with promoting insurance coverage and benefits, employers can support a healthy workforce by offering robust preventive insurance coverage through their employer-sponsored insurance. As already mentioned, healthcare makes up 8.5% of total employer costs for each worker nationally. And in Arizona, public and private health care payers could save $351 million by reducing the prevalence of just hypertension and diabetes by 5%. Thus, workplaces can contribute to promoting health by phasing out grandfathered plans that do not meet the provisions of the ACA and offering plans that robustly cover preventive and wellness services along with all of the other essential health benefits that are required of qualified health plans that belong to the insurance marketplace. In addition, workplaces can promote the utilization of preventive services by employees by helping them understand their positive and cost-free health impact. MCDPH can work with employers to encourage employees to utilize covered preventive services through the development of multilingual and culturally appropriate messaging and materials. Furthermore, education and enrollment technical assistance for small businesses through the Shop Exchange is important, as small businesses are much less likely to offer employer-sponsored insurance when compared to large employers. Particularly, small employers with predominantly low-wage workers, such as restaurants and landscaping businesses, tend not to offer health insurance as such businesses would need to increase their total compensation dramatically. This pattern, which is seen both in Arizona and in the U.S., is particularly important in the context of Maricopa County, as the vast majority of businesses are small. The Shop Exchange reforms the health insurance market by making it less expensive for small firms to provide coverage to their employees. Through its partnership with the Arizona Small Business Association, individual businesses, and navigator entities, MCDPH can help inform Maricopa County's many small businesses about SHOP enrollment and tax credit opportunities through the ACA. Also, small businesses through the Arizona Small Business Association might also contract with MCDPH and other entities to provide education and technical assistance to other small businesses. Beyond insurance strategies, employers, their associations, and unions can partner with MCDPH and its Healthy Arizona Worksite program to implement, and in many cases, continue to implement, evidence-based worksite wellness programs and measure and share results. For this next section, I will share strategies that this collaborative can employ to promote worksite wellness. First, MCDPH can reach out to employers to educate them about the new workplace wellness provisions through the ACA. For example, the ACA authorized $200 million in grants through 2015 to help small employers implement wellness programs. Thus, MCDPH can work with Maricopa County businesses to ready themselves to take advantage of these opportunities. To date, $20 million was appropriated between fiscal years 2011 and 2012 to launch the National Healthy Worksite Program and contract with Viridian Health Management based in Phoenix to help U.S. businesses create and expand workplace programs. This second strategy is one that MCDPH already engages in through the Healthy Arizona Worksite Program, so it ought to be continued and built upon. MCDPH can continue to identify early adopters who can champion workplace wellness initiatives, provide technical assistance, and share best practices with other workplaces interested in implementing such initiatives. Because barriers to adopting workplace wellness initiatives for small businesses include a lack of information on the benefits and implementation process of workplace wellness programs, these champions can provide on-the-ground guidance to interested employers. Furthermore, because small businesses do not necessarily have the resources to support robust wellness programs on their own, MCDPH can facilitate purchasing collaboratives with other small employers to increase their purchasing power and help collaboratives find healthy worksite programs or services. MCDPH can also continue to help employers establish worksite wellness programs, conduct worksite health culture assessments, and serve as a neutral party in surveying managers and employees about needs and priorities. On this slide, you will see the CDC Worksite Health Scorecard, which is designed to help employers assess the extent to which they have implemented evidence-based health promotion interventions in their worksite, identify gaps in health promotion programs, and prioritize high-impact strategies for health promotion at their worksite. MCDPH and employer partners also should enhance and continue to widely disseminate the Healthy Arizona Worksite Program toolkit materials, and the website is pictured right here. They should also continue to highlight best practices and evidence-based comprehensive workplace wellness model policies that focus on improving the overall workplace culture and environment, including occupational health. For example, available on this site is a Worksite Health 101 training manual, a checklist for taking action at one's worksite, and a sample Worksite Health Team Charter, which delineates roles and functions for team members. So there are a lot of great resources right here on the site. Furthermore, there are national and local resources available on the site, which provide best practices and policies for worksite health initiatives. Many additional websites for worksite health are listed here, and these organizations are websites have great resources for worksite wellness initiatives and best practices. I also want to mention that when this PowerPoint is posted, all of these logos that you see here are clickable links that will take you to the respective websites. Another great resource that I want to mention is at wellsteps.com. This website has an available return on investment calculator, which is pictured on this slide. And this calculator helps businesses project the impact of evidence-based programs on healthcare costs, productivity, and absenteeism, and compares these projections with the cost of doing nothing. MCDPH can work with employers to help analyze return on investment and craft and disseminate messages to demonstrate to other employers and employees about how wellness initiatives can impact their bottom line. Furthermore, as worksites collect assessment and evaluation data for their workplace wellness programs, MCDPH can continue to help employers use this data to assess the health of the working population, identify priority areas based on needs and interests, and evaluate the effectiveness of various workplace wellness strategies. As the evidence base for financial incentives and disincentives on wellness programs are mixed, MCDPH, community advocates, and employer leaders should also monitor the impact of these strategies upon workers to document benefits and/or unintended consequences. While individuals in Maricopa County's workforce spend a significant amount of time in the workplace, health is more likely to be attained if wellness efforts are also connected to the community as well. MCDPH can help connect worksites with community initiatives and public health programs to support employees such as chronic disease self-management programs, community gardens or farmers markets, gyms or neighborhood walking groups, tobacco cessation efforts, and more. For example, in Detroit, Michigan, DTE Energy developed a gardens project enlisting the help from schools, communities, and religious groups to plant and grow fresh produce for our community consumption. And in California, Johnson & Johnson Healthcare Institute collaborated with the University of California in Los Angeles to provide materials and training to Head Start parents to enhance health literacy around diabetes prevention and nutrition. In addition, private foundations and hospital community benefits programs are also realigning their resources to support ACA goals. Their leaders are offering financial resources, policy and practice support, and convening opportunities to support workplace wellness efforts that can also serve to bolster their philanthropic goals. One ACA provision that I have not yet mentioned that are the new funding streams for community-based initiatives to prevent chronic disease. The Public Health and Prevention Fund was established by the ACA to redirect health systems toward prevention and strengthen the capacity and impact of the public health system. The Public Health and Prevention Fund was funded by the ACA to direct $10 billion through 2020 toward prevention-oriented activities that will help slow the growth of healthcare costs. The fund's main initiative is the Community Transformation Grants Program, which aims to make measurable differences in chronic disease incidence and outcomes by supporting multi-sector collaborative to make systems and policy change so that the healthy choice is the easy choice in schools and other communities and workplace settings. Public health is in a unique position to convene these diverse stakeholders to collaborate on improving the health of the community. MCDPH can join businesses and community partners in a coordinated effort to get at the root cause of disease. For example, in Jackson, Michigan, a collaborative of public health agencies, employers, community members, and faith-based organizations formed the Allegiance Health Improvement Organization to collectively address population health through community and workplace interventions. The collaborative offered a variety of fee-based and free activities that complemented the efforts of primary care physicians throughout the community in providing preventive care. The collaborative also participated in a community medical record, which allowed for closer integration with primary care practitioners. The workplace-based program included comprehensive health risk appraisals with blood work, personalized health coaching, wellness education, and chronic disease self-management. In addition, the sharing of best practices and the development of the business case for worksite health was intentionally built into the collaborative to ensure sustainability and the replication of successful strategies. And finally, employers can have a strong voice in advocating for prevention funding, as they have a stake in the health of the workforce and the surrounding community. In Massachusetts, public health, faith-based advocates, community-based organizations, as well as business and municipal leaders came together to call for the creation of a new prevention and wellness cost control trust fund as a part of healthcare payment reform law. These funds will be used for programs to stem chronic illnesses such as diabetes, asthma, and heart disease that are fueling the growth of medical costs. The funds for the trust will be paid for by a surcharge on insurers and larger hospitals. Under the expansive prevention program, communities, healthcare providers, regional planning agencies, and health plans can apply for grants to address preventable illnesses. Up to 10% of the $60 million over 4 years are designated to help employers launch work-based wellness programs. The Massachusetts Payment Reform Law also creates tax credits for employers that set up the programs, and it also requires health insurance premium discounts for small businesses with these programs. Another significant and sustainable source of prevention funds can come from nonprofit hospitals' community benefit requirements that can address community building activities such as housing, environmental and physical improvements, coalition building, and more. In Columbus, Ohio, Nationwide Children's Hospital invested community benefit funds into Healthy Neighborhoods, Healthy Families collaboration to address affordable housing, healthy food access, education, and workforce and economic development. So NCDPH and businesses can work on advocating for such funds. The Prevention Institute, by the way, also published a report called How Can We Pay for a Healthy Population? Innovative New Ways to Redirect Funds to Community Prevention. And this report looks at creative examples from states to increase funds for primary community-based prevention. So in closing, health departments and employers have a shared interest in improving the health of employees, and work sites are an important site to promote health equity due to its access and reach to the majority of the adult population. Furthermore, promoting workplace wellness programs and ensuring comprehensive insurance policies is good business, and continuing to document the return on investment of such efforts is essential. The ACA also creates opportunities for new and continued partnerships and shared initiatives, of which public health is a natural convener of such partnerships within the local public health system. Health departments can provide analysis and expertise and guide policies and practices, much of which is already started through initiatives such as the Healthy Arizona Worksite program. And finally, worksites have the potential to be critical leaders for the promotion of health and prevention of disease, and are important partners to engage in the goal of improving population health and achieving the triple aim. So thank you so much for your time, and with that, I will now pass the mic back to Lori for questions and answers.
Thank you, Brittany. Great job. There are two questions that have to do with incentives for small employers, and we may not have the details for those expectations, and we may have to mail them to people, but I will read them off and answer them to the best of our ability. Somebody asked if we could review the incentives for employers that employ under 25 employees to roll in the SHOP program. And then the other one is, what are the expectations for companies with 25 to 50 employees? So Brittany, can you take a crack at that?
Sure. So just to review what the SHOP Exchange will do, the SHOP Exchange is going to reform the health insurance market by making it less expensive for small firms to provide coverage for their employees. And they do that through tax credits. And also because there is now a restriction on premium ratings based on health status, claims history, duration of coverage, and specifically to small businesses, industry group size, the cost for small employers will also decrease. So essentially, employers will be eligible for tax credits to assist them in purchasing health insurance if they have fewer than 25 full-time employees, an average of annual salaries of less than $50,000, and they contribute to at least half of the cost of employees' health insurance. Beyond that, any more specifics we'll probably have to email to folks.
Okay, great. So we will email that question. We will give you 30 more seconds if you have any other questions that you'd like to type in to the question and answer section of the dashboard. We'll be happy to try and take a crack at them. Otherwise, we do recommend paying attention to communications that the Maricopa County Health Department will be providing communications to those who have participated in this webinar at a later date, and so that you can go back to their website where they will be providing more detailed information in the form of fact sheets and technical reports related to the Affordable Care Act and prevention. Were there any other questions that have come in, Brittany?
No, I think those are the questions. Yeah.
Okay, great. Well, we want to just thank you all for participating. This is Lori Stillman and Brittany Chen from Health Resources in Action, and we would ask that you please just take a few minutes to complete the survey that will appear on your screen in a moment. Those responses will go back to the Maricopa County Department of Public Health and will be important for them in planning future efforts. Thank you for joining us, and have a great day.